everyone, my name is Brittany. I am a cardiac ICU nurse. I just graduated from Johns Hopkins 2 months ago, and I want to tell you how I landed a job as a new grad in the ICU. It can be very hard to land a job in the ICU as a new grad because you don't have much experience, or at least they think you don't. But I could tell you from my testimony that you too can do this as well. Don't let that discourage you that you don't have enough experience to get into the ICU right after graduate school or nursing school, whatever program you're in. I personally was in an MSN program. So I have a background in health and I've been in the medical field since I was in high school. I went to a medical magnet high school in Los Angeles, California. From there, I just grew a passion for it. So I ended up basically getting into nursing. The first tip I would suggest to land a job in the ICU as a student nurse or as a new grad nurse is to get a student nursing job while you're in school. If you can manage the timing between studying and working, I suggest you do so. If you're currently in school, sometimes they have opportunities for you to be a student nurse at certain hospitals. So I will ask for opportunities at the Career Center at your school or just look online. They have many student positions so you can work in the ICU. And also, if they don't have any openings, I would just reach out to the managers or do my own research and email them about opportunities of shadowing. And that just shows you're persistent. That just shows that you're ready to learn and you're eager to learn. And they like that. They will probably hire you if you keep being persistent. Also, if you have clinicals, which I know we all do as student nurses, I would suggest you to ask your preceptors of any opportunities that they may know about, because sometimes the preceptors may connect you with the right resources in order to land a job in the ICU. I personally started in Maryland shock trauma, multi-trauma, and it was pretty intense. I took the opportunity to work there for 5 months. I was in my second or third semester, but I ended up landing that job. I worked there for 5 months, got the experience, and then I moved to another job that paid more. It was just it fit better with my schedule. And that experience alone helped build my resume up to vouch for me when I do graduate and land a job in the ICU. So that was my goal because I want to become a CRNA. So you need the ICU experience in order to become a CRNA, at least 1 or 2 years. Once you land the jobs in a ICU, it's best to network. Don't be shy. Ask a lot of questions. And when they open positions for when you graduate, you can apply to that specific hospital if you like it. And if it fits your needs, As a new grad, you want to make sure that you're very eager to learn and you put your best foot forward, because they don't just hire anybody in the ICU, and they dang sure don't like new grads because they feel like we are babies. We're just learning this stuff, and the ICU is very intense. We're taking care of critically ill patients, and it's nothing to play with. I'm personally in a cardiac ICU, so I take care of people after surgery. And how I landed my job, I was a student nurse in the ICU, in a general ICU, where it was a medical ICU, neuro ICU, and surgical ICU, all in one. And so then from there, I had my last practicum of nursing school, my last semester. I was able to land a job in an open heart step down unit. So that's basically like the IMC for cardiac surgery. After I finished my practicum in the cardiac ICU, I got very close to their managers, and they hired me on the spot because they seen how eager I was to be a good nurse, and I wanted to be in a cardiac ICU anyway because that's the best experience you could get, not only as a nurse but for CRNA school, because CRNA school, they're big on hemodynamics, and you need to know the process of how the blood moves through the body and how it can affect a person's heart rate, heart, and just body organs. You have to know these things, and it's very important to get the best experience you can and put your best foot forward, because they're looking at you. They're going to ask you questions, and you got to be ready to answer them and understand why you're giving certain medication, and just learn what common medications are used in the ICU and what they're used for and how it affects the patient and how it's supposed to treat their symptoms or conditions. So for anybody looking for tips on ICU, hit me up on LinkedIn. I'm down to answer any questions. You can also leave it in the comments of topics and things you would like to see on my channel. And I will be glad to make more videos. I'm finally out of nursing school, guys. I passed my NCLEX. I'm happy. So I'll be posting a lot more. Just tell me what you guys want to see. Thank you for tuning in. Don't forget to like, comment, subscribe, and also have a great day. And I got these scrubs from Figs. These are so cute. They're very comfortable. They're the fall season colors, and I suggest you buy them. They're comfortable. They do not shrink in the dryer. Shout out to Figs. Y'all really doing it.